This whole disease is terrifying, and at least for the rest of us, we have something we can do. We can socially isolate, we can wash our hands, but those people have nothing they can do. It's a terrifying situation, and right now is the time to do something before the outbreaks get in there.
Dr. Josiah Jody Rich treats coronavirus patients all day at a Rhode Island hospital. He's also a Department of Homeland Security consultant as an expert in prevention of disease in detention facilities. He urges President Trump's administration and elected officials around the country to release as many detainees as possible before it's too late.
It's not just ICE detention, it's any detention facility, any place you have people congregated together. They're all eating in the same cafeteria, they're all walking in the same hallways, all opening the same doorknobs. And once it gets in, very hard to stop it.
In federal prisons, 10 inmates have tested positive for the coronavirus. In response, the White House has directed prison leaders to expand the use of home confinement. At the state and county levels, thousands of inmates have been released. But ICE has yet to shrink its existing detention population despite 2 known cases of coronavirus among detainees. Thousands of medical professionals have also called for the release of non-violent and vulnerable immigrants.
We have a very narrow window of opportunity to avoid a lot of unnecessary infections occurring at the same time.
ICE has the authority to release most immigrants awaiting deportation or asylum hearings. Out of 38,000 detainees currently in ICE custody, less than 15,000 have criminal convictions. The agency announced last week that it will delay arrests and use alternatives to detention except for those who have committed certain crimes or pose a public safety risk. But the policy shift doesn't apply to non-violent immigrants already behind bars. The Trump administration also closed the southern border to asylum seekers to reduce the intake of new detainees.
Our goal is to not even bring people who cross the border illegally into those facilities at all. It's to go straight back to the ports of entry, to return them to Mexico.
ICE says it screens all new detainees for the coronavirus, consults with local health departments to assess the need for testing, and isolates those with fever and/or respiratory symptoms.
ICE has a standard medical process. No one comes into their facility without medical processing, and they have tremendous quarantine capabilities that they exercised literally for thousands of people last year at the height of the crisis.
Rich says he understands that releasing detainees, even non-violent ones, is politically risky. But he says from a public health perspective, the benefits far outweigh the risks.
You don't want somebody, a bad guy, coming out of a detention facility and hurting people and killing people and causing trouble. But here, public safety there's a different definition of public safety, because everyone that gets unnecessarily infected on the inside and has to come out to an outside facility is going to be taking up a bed or a ventilator that could be used by other people.
Ben Chamiso, Newsy, Chicago.